Hi everyone, I am Stephanie with 9Health. Apologies, we were having some technical difficulties getting onto Facebook to go live today, but here we are. Hopefully you can see us. I will check my phone and make sure that we are actually live and things are actually working. Today we are talking about mental illness. It's Mental Illness Awareness Week. We're with Jason Youngblood. He's a licensed counselor from Stigma, and of course 9Health expert Dr. Powell Coley. We're going to talk about different mental illness issues, different mental health conditions. Stigma has partnered with 9Health to offer some screening tools on our website. They're free, anonymous. You can go to 9healthcare.org to check those out. I'll post the direct link in the comments if it'll let me. If not, I'll put it directly in the post. But again, Stigma's they've helped us build out these free online mental health screenings. So you can kind of check where you stand as far as depression and anxiety go, and get a good baseline of where you're at. Or you can even take them daily. They only take a few minutes. If you're feeling off, you can just kind of get on there and answer a few questions and kind of see where you stand. So it's kind of nice. Matthew, thank you, just said hi there. So I think we're good. I think we're good and live. So first, the National Alliance on Mental Illness says 1 in 5 adults in America live with a mental illness. Jason, I want to start with you. Can you just talk about what conditions classify as a mental illness, and how do you know when it's something serious? If you're actually depressed, is just feeling sad that day.
Yeah, you've mentioned a few of the conditions that can be classified as a mental illness, and mental illness, just like medical conditions like diabetes, are considered to be diseases. And so every disease has certain signs and symptoms that allow us to be able to diagnose them and classify them. So you mentioned a few, like depression, anxiety, there's substance use disorders, there's mood disorders, eating disorders, autism. There's over 200 different mental health classifications for mental health disorders. I think your question of how do you know when there's a difference between just feeling blue, feeling anxious, and having an actual diagnosable condition. Certainly when things happen in life, we've all been under a lot of stress. It's normal to have a reactive period of time where you're feeling blue, anxious, not settled. I think the way that you can determine, take a survey, take a tool online, but if you're feeling blue or you're feeling anxious or whatever it may be is interfering with your ability to conduct your day-to-day activities, like taking care of your children, getting to work, working a full day, being productive, those types of things, then that's something that you really want to pay attention to. Also, look for red flags from people that you love and care about who might be asking you or expressing concern for you. Pay attention to those things and accept that feedback and perhaps accept that support.
Yeah, I think one of the things we've even said in one of our Facebook posts, it's, listen, really listen. If you ask how someone's doing, really listen to them and really kind of assess where they're at and see if you can help at all. Dr. Coley, many are struggling with mental health during this pandemic, whether it's from isolation of being lonely, or we even talked earlier this week that some that have been diagnosed with COVID-19 experience some mental illness or mental health conditions with that diagnosis. Can you talk a little bit about how the mental health effects of the virus?
Stephanie, that can really be broken up into 3 different buckets. The first is the direct mental health effects of the virus itself. The second is the mental health effects of symptoms of the virus, like fever. And then the third is, mental health effects of the treatments that we use to treat the virus. So let's talk about each of those. So the virus, we know, can invade the central nervous system directly. That's what's so unusual about this virus, that despite being a respiratory virus, we know it can cause loss of taste, loss of smell. We have seen cases of things like encephalitis, which is a condition, inflammation of the brain, that can occur from the virus itself. And studies have told us that a third of hospitalized patients have mental health effects that are thought to be related directly to the virus. And that can range all the way from confusion, delirium, all the way up to coma or obtundation. So it can have variable different effects. In the outpatient setting, it's a little less well understood exactly how the virus itself can affect the central nervous system and the brain, but presumably it can have effects in that setting as well. Then the second bucket is the symptoms of the virus. So of course, things like, being in the hospital can cause you to be delirious. High fevers can cause you to be delirious. When your oxygen level goes down, if it's down quite profoundly, it can affect your cognitive function or your ability to think clearly. So some of the other effects that the body that the virus imposes on the body, such as lack of oxygen or fever, can also lead to mental health changes. And then finally, we've talked about treatments and how those could possibly also affect our mental health. And steroids, for example, dexamethasone, which is used to treat some of the more severe cases of coronavirus infection, can cause lots and lots of mental health effects, ranging all the way from mania or hypomania, psychotic reactions at about 25%. The mania occurs in about 35%, all the way to depression, which can also occur in a majority of people. So a lot of these questions have really come to the forefront most recently because of the President of the United States getting infected with the virus, with a lot of people asking whether his hospitalization, which can cause delirium, his advanced age, which can make him more susceptible to these side effects, his fevers, his dropping oxygen, his treatment with steroids, whether all of these effects could directly or indirectly contribute to mental health effects in him.
Yeah, that's kind of what I was going to follow it up with, as we talked a little bit about that earlier, how some of these medications and treatments can kind of cause some delirium. You reacted on the news earlier this week, the president removing his mask right away when he came, he's back at the White House. So some shocking things that have kind of happened, and it's good to understand kind of how those treatments might affect us, or how COVID-19 can affect our mental illness as well. Jason, a new study from Stigma shows American resilience is at risk. Can you talk a little bit about what is resiliency and why that's important?
Yeah, resiliency is a set of coping skills that allow us to rebound from challenges. And Stigma surveyed over 16,000 participants across the United States, ranging from young all the way up to older folks. And the results were really fascinating. What it found is young children are the most naturally resilient, the most resilient of any age group. And I think that for those of us who have been around young children or have young children, we can identify they do tend to recover from things pretty quickly and be able to move forward. At around the age of middle school, the resilience starts dropping, and it gets to a low between the ages of 18 to 23. So that's kind of sad for my oldest, I have a daughter who's starting middle school, and to see that resilience naturally drops there, and 18 to 23 is the most challenging time. Fascinating enough, when we have children, we get to that childbearing age when we're around children again, our resilience starts to build up. So what does that tell me? Resilience is maybe natural, a lot of natural abilities. We learn bad coping habits over time, but the great thing about that is that we can unlearn those and build on our resiliency, just like a muscle. The more that you work it out, the more that you exercise it, you can build your resilience.
Yeah, and again, it's Mental Illness Awareness Week, so we're just talking about different mental health conditions, mental illness in general, kind of how the pandemic overall and COVID-19 itself can affect our mental health. Jason Youngblood is the licensed professional counselor with Stigma, and of course, 9 Health expert Dr. Powell Coley. You can ask any of your questions. I was kind of looking at the comments a second ago. Annette said that she had a friend's son pass away from mental illness the other day, and it's really something to take seriously. And like Jason said earlier, when you're asking someone how they're doing, really listen to them and figure out what's going on with them, if they need help, if they're trying to reach out for help. Something encouraging Jason just said, though, about the resiliency report that Stigma just came out with is that, children do bounce back pretty well, which makes me feel a little better with all this stuff going on. I've kept my 4-year-old home. I have a 10-month-old. It's nice to hear that maybe, they'll bounce back from this a little better maybe than we will, and or some of us will. So that's kind of a good positive thing that Jason just mentioned. And having kids makes things maybe a little better too. So that makes me feel a lot better. So thanks, Jason, for some positive insight.
You're welcome.
Dr. Coley, I want to talk to you. I keep asking you, just about the coronavirus and how it's affecting our mental health. We've talked to you before about coronaphobia. It's a mental health issue now. I think it's kind of been, thanks to the pandemic, we have this new condition. Can you talk about what it is and how people can kind of look out for their mental health right now, maybe avoid entering that coronaphobia, stage of things?
Yeah, coronaphobia has recently been recognized as a formal psychiatric diagnosis. And again, as you said, it's really new to us because it didn't exist a year ago before this pandemic happened. So there's really two kind of main components of coronaphobia. The first is, an extreme or irrational fear of catching the virus. And again, as Jason said, to the point that it's interfering with your daily functioning. That's really, the warning sign there, because we all have to be alert. We all have to be a little bit fearful of the virus and protect ourselves. But if it starts to interfere with your functioning to the point where you're afraid to leave the home, or you're having a lot of recurrent, repeated, anxious thoughts about the virus, or about whether you wash your hands or you keep washing your hands over and over again, those types of behaviors could suggest that it's starting to become pathologic. But the second part of coronaphobia, which I also want to draw attention to, is an irrational fear or a worry about being around those who have contracted the virus and recovered from it. And this is becoming a problem in our society, to the point where a lot of people that have caught the virus and recovered are now starting to feel ostracized or feel isolated or feel stigmatized because people don't want to be around them. So I think the best way to battle both components of that is really to understand a few things. First is that this is a natural feeling and a natural reaction. So when HIV first came out, we didn't know much about how it spread. There was an HIV phobia. There was a fear of being around people who had it. There was a fear of wondering if you would catch it, and being afraid to interact with those who might have caught it and be suffering with it. And that's normal because it was unknown. But what we've learned in the last several months about coronaphobia, about coronavirus, should really allay our coronaphobia. It should really help us understand that we know now a lot about how it's spread, about how it's treated, about how to minimize our risk, and about how long the people who have it are infectious for. And the fact that they've recovered, in a way, makes them even less likely to bring it to you, because now they probably have antibodies, at least for some period of time, that protect them. And therefore, those antibodies protect you if you're around them. So I think understanding the science of the virus is the best way to really start to combat this. And I think it's really important that we all combat it together, because 7.5 million Americans have contracted coronavirus. And these are our mothers, our fathers, our brothers, our sisters, our children. We cannot ostracize these members of our society. We can't be afraid of them. And tomorrow it could be one of us. So we really do have to think about kind of how to balance, of course, caution with this excessive irrational fear. And if you feel like you're somebody who's falling into these kinds of obsessive thoughts about worrying about the virus, catching it, or worrying about being near somebody who might have caught it, you do need to definitely reach out to your doctor and bring it up, because the earlier we treat this, the more we can start to change those thought patterns.
Yeah, again, it is just the fear of the unknown. So listening to Dr. Coley and, listening to the facts and the science and just becoming knowledgeable about things is really kind of the best way to combat that, like she said. Jason, we wanted to talk about breaking the stigma around mental health conditions. We really need to start treating our mental health like we do our physical health, talk about it in the same way. What are some other ways that people can help break the stigma of mental health conditions?
Yeah, well, speaking of stigma, as 10 people have mental illness nationally, studies show that only 4 of them out of the 10 would ever actually get treatment for that mental illness. So imagine if that was the case with somebody who had diabetes, only 4 out of 10 people, and how catastrophic that would be for their life. We know that people with mental illness and medical conditions both tend to live 25 years less if they don't have their mental illness treated, and those are people with chronic conditions. So stigma is a real thing, and stigma costs us a great deal on a personal level and on a societal level. I think your very first question, understanding that mental illness is very common, according to the National Alliance on Mental Illness, 1 out of 5 of us. I have been very anxious since I was a small child, and it is a condition which meets the criteria for a diagnosis that I manage and live with every single day, and successfully most days. So talking about it, being open, realizing that you are not alone, and understanding when you should seek treatment or seek help. I think the silver lining here of COVID is that now there are a lot more ways to get help. There's a lot more virtual or telephonic options that were kind of on the fringes before. And so you can gain access to care. There's a ton of apps to help support emotional well-being, including peer coaching that are out there and ready for you, that really, if you didn't want to put your name out there, you could do that and stay anonymous. The other thing that I've seen really come and to be popular is mental health first aid. It is like CPR training, except it's about mental health. And so participating in a mental health first aid course, Looking at the National Alliance of Mental Illness webpage, Stamp Out Stigma webpage, there's a lot of things that you can do to promote mental well-being and to take care of yourself and those that you love.
Yeah, that's all good advice. And I've mentioned this a couple of times now, but we partner with Stigma to provide some free anonymous online screening tools. You can answer just a few questions about anxiety or depression, kind of see where you stand. It wouldn't let me post the link in the comments, but I did put that link in the description of our Facebook Live. So if you're interested in checking out those screenings, you can do that for yourself. Dr. Coley, I mentioned it just a little bit ago, but there's really this mind-body connection with our physical health and our mental health. Jason's talked a little bit about it. What are some of the physical health problems that someone might experience that are tied to mental illness?
It's a really important question, and they can be subtle, and sometimes you don't even realize that it's a result of your mental health that's driving these physical problems. So let's talk about anxiety first, for example. So when you're anxious, your body actually releases stress hormones, including cortisol, that can have a number of different physical effects. So cortisol raises your blood pressure, it causes salt and water retention, and it suppresses your immune system. So it makes you more susceptible to viruses, infections, all kinds of other chronic problems. Of course, anxiety can cause weight gain or weight loss, depending on whether you happen to be a stress eater or indulge in behaviors that may cause weight gain, such as being more sedentary, not exercising as much. Or the opposite. If you're anxious and you don't feel like eating, or you just have a lot of extra energy, you can actually have weight loss happen. And similarly with depression, we can see a lot of those similar types of phenomena. Some people gain weight, some people lose weight. You obviously perturb your sleeping patterns, which can also affect your immune function. It can affect your cancer risk because it affects your body's ability to repair DNA damage, which is what occurs when you're sleeping. It can affect your mood and kind of cause more of a spiral. It can affect your interpersonal relationships. So both of those can have very profound effects. And the effects can even be actually more severe. What we've seen, for example, occur during this pandemic is something called a higher incidence of broken heart syndrome. And that's called Tacosupos Cardiomyopathy, which is essentially when you have, the bottom part of your heart stop beating normally because of a discharge of stress hormones from your brain. Now, normally we see this under circumstances of extreme emotional trauma, so a death in the family that's unexpected, a car accident, some other kind of physical trauma, that can trigger this condition called Tacosupos cardiomyopathy. But what we've seen in the last few months is that the number of presentations we're having for Tacosupos during the pandemic is significantly higher this year than it was at this time last year, suggesting that these mental health effects may be manifesting themselves not just in these minor things that we talk about, higher blood pressure, salt water retention, weight gain, but actually these profound problems that can end you up in the hospital, the intensive care unit, and can cause long-term health issues.
Yeah, so again, just more motivation to really check in on yourself, check in on others, make sure we're all taking care of our mental health. And again, try to break that stigma like Jason talked about with, just treating it more like it's a condition that someone might have, as opposed to, stigmatizing it really, and just not treating it seriously, not taking it seriously, just trying to understand. If you're not going through it, try to understand someone else that is going through it and just help them any way you can. You can continue to post questions in the comments. We didn't get many questions, it's more just reactions. Matthew, I think, checked in on everyone as everyone was doing, so that was very nice of you. But if you have any questions about mental illness or mental health, you can post those in the comments even after this live ends, and I can pass those along to Dr. Coley and Jason. And I want to make sure to mention before we go here, we are having several 9 health fairs this fall. I think there's only 5 left, and only a couple that are close to the metro area, but you can register now for a 9 health fair this fall. Go to 9healthfair.org, click on find a fair, and you can see the list of locations. If you're still not really wanting to leave the house much or don't want to go out to a bigger crowd, we are taking appointments for the 9 health fairs, so they're not the huge crowds you're used to seeing. But you can also make an appointment at Quest Patient Service Centers and go on your own convenience and individually just go and get those screenings done. And again, Cigna and 9 Health are offering these free online anonymous mental health screenings for anxiety and depression. I've posted the link in the description. You can go take those screeners. And if you have a medical question or a mental health question you want answered, you can still call the 9 Health Neighbors line. It's 303-698-4455, extension 2005. Leave a message, a 9 Health medical volunteer will call you back within 24 hours. You can talk to a real person. They'll refer you to someone else if they need to. They'll answer the questions that you have about mental health and your physical health as well. I want to thank both my experts for joining me. We're going to sign off from here. So thank you both so much and have a great day.
Thank you.